Sorry.
Hi, before we start, would you like a glass of water or a snack or anything?
No, I'm okay.
Okay. Um, so my name is Maria. Um, and what's your name?
My name's Anna.
Anna? Okay. So before we start, I want to talk about something very important, and it is confidentiality. Everything we discuss in these sessions is private, and I will not share anything you say without your permission. Okay?
Okay, that sounds
There
good.
are, however, some important exceptions to this confidentiality that I want you to be aware of. If you were to express that you were in imminent danger or harming yourself or someone else, I would need to take steps to ensure safety, which could involve sharing information with others or a doctor or emergency services. Is that okay?
Yeah, no, that's understandable.
Okay. I will always try to talk to you first if there's a situation where I will need to break confidentiality so we can discuss it together. But overall, the goal is to protect your privacy and make sure you feel comfortable and safe in our sessions, okay?
Okay, thanks.
So before we start, the intake report, we're going to do an intake report assessment that will help provide a foundational understanding of your personal needs, circumstances, and goals that help create a more personalized treatment plan um, for your overall needs. Um, so how does that sound?
That sounds good.
Yeah. Okay. So so Anna, let me get this. So is it okay if I'm like writing down or typing right now?
Yeah, that's fine.
Okay. So your first name is Anna. Can I please have your last name?
Yes, Blair.
Blair.
Yes,
What about your date of birth?
November 2000.
November 11th, 2000. Okay. Okay. And can I please have your age and race of ethnicity?
Yeah, I'm 23 and I'm white.
And who made this referral and why?
Um, it was actually, I have just come out of a inpatient hospital, so it was the doctor there that had referred me to you guys.
Okay. That must have been really hard being in an inpatient hospital.
It just happened, so it's still pretty fresh.
Okay. It can be extremely hard. Mm, can you give me about maybe some 1 to 4 presenting problems that
Yeah,
have been occurring?
yeah. So basically, I have just in the last few months or so been hearing voices at random
Mm-hmm.
times. At first, it was just, once or twice, not very often. And suddenly it got to be a lot more rapid, happening almost every day and all the time. A lot when I'm going to sleep, I can't get the voices to turn off.
Mm-hmm.
It, in better terms, it made me feel crazy. So I was told at the hospital that I was having hallucinations and was basically just being told by these voices that I would have to do certain things in order to protect myself, protect my family. And
Yeah.
nobody else was hearing these voices. So I agree that it was probably hallucinations that I was seeing.
Mm-hmm. That's that sounds very intense.
Yeah.
Um, and currently, have you been having any of these symptoms right now?
Not much since being out of the hospital. Um,
Mhm.
I am very scared though that it will come back and am trying to stop that before it happens.
And have has so the before you were in a inpatient facility, before your initial um arrival, Was that the first time you had been having those
Um,
symptoms, or have you had like a history of these?
I've had a little bit of a history of it. I think it started more at the beginning of this year
Hmm.
and maybe more so like March. And
Yeah.
when it was kind of just, once or twice that month, not much. And then
Hmm.
by the time it hit May, I was getting them more frequently. And
Okay.
it is just, I went into the psychiatric hospital in the beginning of October. So it is kind of just went rapidly until my inpatient stay.
Okay. Um, and whenever you have these symptoms, do you feel like you have them like all day or like throughout the week? Like, do you feel
More,
like impaired basically like from going to like work or school?
yes, more frequently, not at the beginning, but lately, yes. It seems like I can't get the voices to turn off. So, like I said, I'm just needing to have them stop forever.
Yeah, that can be really hard. Um, so this is kind of how do I say it? Hard question, but have you had any have you had any current or history of suicide?
In the past, yes. About in June, July, when it was getting really, really bad, I did think the only way to turn them off was to commit suicide. But I didn't take any action or anything, but it was a thought that went
Yeah,
through my head quite
yeah,
often.
yeah. I'm really sorry about that.
Thank you.
Um, have you seen in the inpatient facility, did you see a psychiatrist?
I did.
Yeah, okay. And prior to this, have you had any other therapists?
No, this was the first.
Okay. And with the psychiatrist, have you been prescribed any medicine?
Yes, she prescribed me a psychotic medication. I don't know exactly the name of it at this time, but I am on some sort of psycho
Mhm.
medication prescribed by her for the past couple of months.
Oh, okay. Can I please have her name?
Yeah, it is Dr. Schuyler.
Okay. Okay. Um, and do you feel like this medication has been helping like with your hallucinations or like your symptoms right now?
Yes, definitely. The voices are a lot quieter and not
Yeah.
so haunting.
Do you feel like you've been having like some impactful side effects?
Not too much, just very tired all of the
Mm-hmm.
time.
Oh, okay.
So just been very sleepy.
But do you feel like it's something maybe like you can still keep going with your day? Like,
I would think so. I think I might
yeah.
just have to get used to it.
Okay. Okay. That sounds really great. Um, sorry. Let me look for it right here. Mm, so this is going to be a little bit about family history.
Okay.
Um, has any of your family ever had of had any displayed any of this behavior, mood, anxiety before, like of trauma, substance misuse, or other disorders, such
Yeah,
as like your parents, siblings?
yeah, actually, my grandfather, he was kind of notorious for being out of his mind, kind of just talking out of his head, which I
Hmm.
kind of just thought that was his personality. But now, as these are progressing with me, I start to feel like maybe he was having some of the same issues that I've been
Hmm.
having issues with. So I don't know exactly what that illness might be, but he has presented those in the past, yes.
Okay. Is this from your mom's side or your father's side?
It's from my father's side.
Your father's side? Okay. Um, and do you currently use drugs or alcohol?
Not currently. Before, when to try to get everything of the voices to stop, I was drinking pretty often.
Okay. How often would you drink?
It was about every day.
Every day?
about 5 drinks a day. Yes.
Okay. Have you ever received treatment for substance misuse or anything like that?
No, we talked about it at the inpatient hospital, but it wasn't like I was having to detox. So,
Yeah. Okay. And have you ever had like any legal history regarding this? No.
no.
Okay. Um, so a little bit about you. With who did you grow up with?
I grew up with my older sister and younger brother and my mom and dad.
Your mom and dad?
Yes.
How's the relationship between you guys?
It's really good. The relationships between my parents have gotten a little strained as I don't believe they really understand what's going on with me. Um, but they're working towards it. So it's been getting better.
Yeah. Okay. I'm happy for you. Um, so right now, are you married or have any relationships?
I have been married and I am divorced.
Okay. What about any children?
No children.
No children? Okay. And what about education and employment?
I am
Tell me a
current
little bit about that.
Yeah, I'm currently working at a library full
At a
time.
library? That's awesome. Um, have there been any family stressors that you think that could have impacted your behavior, anything as of recently, like death, a birth or moves or a divorce?
Yeah, I think possibly the divorce that I just went through kind of kick-started a lot of it.
Mm-hmm.
Even just before the divorce and when we were fighting often, I think
Mm-hmm.
that was an added stressor that, you know, was overplaying my brain a little bit. So I definitely think my divorce has played a big part in this.
Yeah. And how do you feel now?
I feel better. I think the inpatient hospital did really help me. I'm just very anxious that I'm not going to stay better forever.
Yeah. Okay. Um, is there a history of military service?
No.
No. Okay. Is there a history of verbal or sexual or physical abuse?
Yes, by my ex-husband, I was physically abused.
I'm really sorry to hear about that. Um, as of right now, you say that your family has been a little bit more supportive.
Yeah, more specifically my sister, I believe.
Your sister,
Mhm.
okay. And is she and what do you do to help cope with like these stressors right now?
I have just started to journal more often before I go to bed every night because that's when the voices really start to talk more. So I think getting thoughts out of my head and putting it onto paper has been helping me a little bit and just
Yeah.
listening to music.
Okay, that sounds really great. Is there any history of legal problems or anything like that?
No, just going through a divorce with my abusive ex-husband.
Okay. And I'm gonna ask you a little bit of your medical history. Have you had any medical conditions or issues that you've been anything like that?
No.
Okay. Do you have any non-prescribed, any non-psychiatric medications
Yeah, just for allergies.
or allergies? What kind of allergies?
Just a lot of, you know, nasal things like that. I have allergies to trees, so it's often that I'm having issues.
Have you ever had any any other hospitalizations
No,
other than the inpatient one as of currently?
no, I believe that was it.
Okay. What about any history of a head injury or anything like that?
No.
No. Okay. Um, okay, it looks like we're done. with everything. And I do want to say thank you for answering these questions so that can help us best suit your needs and come up with the best treatment plan for whenever your sessions start for therapy. So is it okay if I see you next week around this time again?
Yeah, I would like that.
Yeah. Okay. It was really nice meeting you. Okay, Anna.
All right. Thank you so much.
I hope you have a great day.
Thank you. Thank you.
Bye bye.